HIV, what you need to know for your medical school exams. HIV stands for Human Immunodeficiency Virus, and it is transmitted through the blood, semen, vaginal fluids, and breast milk. First, let's talk about the structure of the virus. HIV is a retrovirus. This means that it contains RNA as its genetic material instead of DNA. The virus also has a lipid envelope that surrounds it. HIV targets a type of white blood cell called the CD4 plus T cells, which plays a crucial role in the immune system. Once the virus enters the bloodstream, it attaches to the CD4 T cell and begins to replicate. Over time, the virus can destroy these cells, weakening the immune system and making the body more susceptible to infection and cancer. There are 3 stages of HIV infection. We have acute, chronic, and AIDS. During the acute stage, a person may experience flu-like symptoms such as a fever, headache, and rash. This stage typically lasts for a few weeks and is often mistaken for the common cold or flu. The chronic stage is the period during which the virus is actively replicating in the body, but symptoms may not be present. This stage can last for several years, and without treatment, the virus can continue to damage the immune system. AIDS, or acquired immunodeficiency syndrome, is the final stage of HIV infection. At this point, the immune system is severely compromised, and the person is susceptible to a wide range of infections and cancers. AIDS is diagnosed when a person's CD4 plus T cell count drops below a certain level, or when they develop an AIDS-defining illness, such as pneumonia or certain cancers. There is currently no cure for HIV, but antiretroviral therapy, ART, can effectively control the virus and prevent the progression to AIDS. ART is a combination of medications that target different stages of the virus's life cycle, and it is critical to start treatment as soon as possible after diagnosis. Now, let's talk about prevention. The most effective way to prevent HIV transmission is to practice safe sex by using condoms and getting tested regularly for HIV and other sexually transmitted infections. HIV can also be transmitted through sharing needles, so it is essential to avoid sharing needles for drug use.